Jeff Moody here, and today we're going to talk about burnout, mental health in the time of COVID. If we thought burnout was significant before, I can definitely tell you that I think COVID has kicked that up to an 11 on a scale of 1 to 10. Who am I? My name is Jeff Moody. As I said, I'm a board-certified urologist, and I like to think of myself as a burnout-ologist. I got extremely burned out about 5 years ago, and I learned a lot. I worked on myself a lot, and I was able to teach others how to overcome burnout. I wanted to help others get from where they were to where they want to go, and also, if possible, prevent people from going through what I had been going through. Why did I do this? Why do I do this? Because one physician per day in the United States commits suicide. And I tell you, from a physician standpoint and from a hospital leadership standpoint, I totally know where you are. I have been in the office or the operating room almost every day in the last 6 months, and we have been contemplating practice shutdowns, practice solvency, maximum uncertainty we've had to deal with. And I know the leaders of our organizations, both our hospital and our practice, we have had difficulties that have been unprecedented. But fortunately, I've again written and taught extensively about burnout and have served on boards of companies with more than $100 million in revenue. So this has been going to 11 for me. And personally, there have been times, especially back in March and then again in July with the spikes of the cases in our area, there was some fear myself. Would I go to work and catch something that could kill me or bring that home and cause harm or death to my family? It has been a challenging, stress-inducing, burnout and mental health-inducing issue time. Yuval Harari wrote a book called Sapiens, and in that book he said one of the greatest powers that humans have is the ability to imagine, believe, and create our own reality. I agree with that, but I'd like to add a fourth superpower. I think our fourth superpower as human beings is our ability to tell a story. So today, we're going to write a new story for you as the doctor and as for the people who you lead. And let me let you in on a little secret. We're going to let you be the hero. Someone famous and fairly internationally successful recently said to me, "You know what, Jeff? You're not a doctor or a consultant or speaker, you're a storyteller." And I thought about that and I said, I agree. Every day when I'm talking to patients, I am telling them a story about their disease, their treatment, and their prognosis. As a consultant, I'm helping my clients write their own news story to get new results. And today, as a speaker, I'm going to help you create your own story and have a new path going forward. So let's start this particular story perhaps in February of this year. This is a time when, of course, as we know, burnout was defined by Christina Maslach as emotional exhaustion, depersonalization, and lack of personal accomplishment. Or as I like to think of it as, I don't care about you, and I don't care about your Google review that you told me that I did a bad job. So the problem with burnout, I think there are other components as well. I think there's an element of frustration and anger. There's an element of maybe powerlessness, as well as an element of hopelessness. I hope those are not components of most people, but in general, I think as burnout becomes severe, those become significant. We know statistically prior to COVID, at least 44% of physicians were burned out. And if you look at any one element of those scales, perhaps even 70 to 80% of physicians are exhibiting signs of burnout. 1 in 7 doctors have thought of suicide. 70%, that's 70% of physicians would not recommend healthcare as a profession. And we also know statistically that physicians who are burned out are much more likely to go to part-time work. I think probably to titrate their exposure to what they feel is causing their burnout. Burnout is expensive. Total productivity declines in physicians who are burned out. And if that physician, in either yourself or in your organization as a leader of those physicians, if that physician becomes burned out and leaves, it will cost you at least $500,000 to $1 million to replace that person and that productivity. Burnout employees in general within your healthcare organizations are also 63% more likely to take a sick day. They're 23% more likely to access the emergency room, and they're 2.6 times more likely to leave and look for work elsewhere. Burnout is definitely expensive. But then, there's no risk to anyone else, correct? It's only a personal problem? No, burnout is actually quite dangerous from a risk standpoint. There's up to 3 times increased incidence of medical errors in burnout versus non-burnout physicians. The malpractice risk associated with burnout is 40 to 50% higher in burnout physicians. And in an ICU study, there was an increased mortality in patients who were cared for by burned out doctors. So clearly, there is risk to yourself as a physician and to your organization as a leader of those physicians. Mental health worldwide always has been a challenging issue, and even prior to COVID, the United Nations estimated that 1 trillion, that's with a T, $1 trillion were lost every year due to anxiety and depression. That depression actually affects up to 260 million people in the world, and suicide is the second leading cause of death worldwide in young people ages 15 to 29. So we already know prior to the pandemic, so in February of 2020, we're in a fairly toxic, critical place. But let's add in a little global pandemic into that toxic mix. Now, in addition to where you were, you have a horrific, deadly, and economically, emotionally, and personally damaging context in which to try to practice medicine and care for people and run your organizations. Personally, 2 of my 3 kids have had COVID. They've required fine, but they've been exposed and they recovered. And I think in general, if you want to talk about whether or not burnout and mental health are going to an 11 out of 10, I think maybe they're going to a 30 out of 10 in this time frame. And some of the worldwide statistics may support that. There have been disaster helplines that have been set up in times of need. One is run by the Substance Abuse and Mental Health Services Association. They saw a 340% increase between February and March of 2020 in calls to the disaster helpline, and a nearly 900% increase in calls to the helpline compared to March of 2019. In Canada, 47% of healthcare workers reported a need for psychological support. In China, up to 50% of healthcare workers reported depressive symptoms, 45% reported anxiety, and 34% reported insomnia. In Pakistan, large number of healthcare workers reported moderate at 42% and severe, 26%, psychological distress. And in Ethiopia, there was a 3-fold or a 300% increase in depressive disorders since the beginning of the pandemic. So the pandemic has, like I said, maybe didn't even turn it up to 11, maybe it turned it up to 30. What has happened to healthcare economics in the United States? 1.4 million healthcare jobs were lost in April of 2020. The ambulatory sector sustained 82% of those job losses, and physicians' offices alone lost 243,000 jobs. So I always kind of like to talk to my patients that in life and in medicine, in this particular situation, there are general 2 questions. How bad is it? And I think we can see it's pretty bad. And what are we going to do about it? So let's see how we're going to move forward from where we are. Particularly, I think we need to look at the drivers of burnout. And I think one of the most critical aspects is, if you want to really boil it down, is what are the things that push your buttons? What makes your blood boil? Those are your drivers of burnout. And from a physician and from a leader standpoint of organizations, I think your drivers become your to-do list. Because studies show that both personal and institutional factors are critical for getting burnout under control and treated well. So from a physician standpoint, I understand that you maybe have a lack of understanding of your situation at this point, of what you're going through. Changing clothes in the garage, showering before you come home, moving into a separate living space to not expose your family to risk. There are safety issues. Burnout has skyrocketed. You may have a lack of appropriate tools or PPE at work, but hopefully that's getting better. There's stress, there's the acuity of the patients, there's the separation of the patients from their loved ones, there's risk for you personally, and also there's an incredible emotional toll that's being taken on physicians. as leaders of organizations, there are numbers issues, there are staffing issues, there's maybe a public perception that you are not doing enough and you're not helping enough. There's risks primarily to your facility. There can be financial issues, there could be bankruptcy, you could have a failure of your system, and there can be personal issues that can affect you as well. So I understand where you're at. This can make you feel scared, lonely. It might make you feel like you're on an island as a physician. And from a leader standpoint, you may feel helpless or impotent or maybe being perceived as callous. But you're really not callous, and you may be perceived as a failure due to things that are well beyond your control. Doctors don't deserve this. Doctors and healthcare providers at this time are putting their lives on the line on a regular basis, and leaders of these organizations of healthcare systems can't lead when there's minute-by-minute moving targets. It's an unprecedented scenario to have to deal with. Albert Einstein has once said that a problem cannot be solved with the same level of thinking that created it. Hence why we need to change your thinking, and we're going to change your stories today. So what I would like to propose to you is that in this unprecedented time of flux and uncertainty, that there are perhaps 4 things that you can do to help get your situation back under control, both from a leadership standpoint and from a physician standpoint. Number 1, you need to control your knowns, and we'll talk about these more in a second. Number 2, you need to plan for randomness. There will be changes that are unanticipated, but if you plan for those or war game those in advance, I think you can be much more ready when they occur. Number 3, you need to be able to course correct, and that may be on a rapid basis. So the decision-making structures that you have in place may need to develop a more lean and efficient time frame. And then finally, for physicians, what I suggest is that you look at the factors that have constructed the life that you live in, and I like to call that your box, and if things are bad, it's your burnout box, and there are components of that you can diagnose and treat as well. In general, I feel what I'm suggesting is simple, but it's challenging. So from an organizational standpoint, I would love for you to control your knowns. And in general, one thing we know is that our people are our highest asset. If you can help them see the way through this unprecedented time in medicine and the uncertainties, they will remember that, and they will be more loyal than you can imagine. If you abandon your people now, you will have lost their hearts and minds forever. So I would please implore you to, at all costs, please preserve your relationship with your staff and your people. Planning for randomness, I think, this sounds a bit of an oxymoron, but I think what I would suggest to you is to war game or to estimate what are the most likely scenarios over the next 1 week, 3 weeks, 5 weeks, 1 month, 3 months, 12 months, 1 year, 2 years, and war game for those and have contingencies going forward. I think if you can plan on those random acts, like a spike in cases or a sudden need for more ICU beds or ventilators, if you can plan for those and you have options to move forward, then they will not come as much a shock to your system and how you can react to them. And then finally, what I would like to suggest is that you can course correct and have a more lean decision making structure within your organizations. And once a random event occurs, since you've already thought of the contingencies for that, you immediately can start walking down that path, taking care of that event. And I would implore also physicians and their leaders to work together. This is a time where physicians should be asking their systems what they can do, and systems should be asking their physicians what they can do to work together. I like to think of a problem-solving solution or a paradigm for questioning that will help the physicians and the leaders in an organization best understand how to move forward. So I like to think of 4 questions. Number 1, how are you? And I think by putting the emphasis on how someone is doing physically, emotionally, psychologically, initially, helps them know that you're not just concerned about what you can do for them or they can do for you. This is not transactional. This is something that they know affects you personally and emotionally. And by putting the emphasis on you first, helps them know that you're starting from there and then you will get to the problems. So question number 1, how are you? And ask that on all levels. Number two, I think you want to determine what is going on or what are the problems and the challenges that we are facing. And the better you define those, the easier they are going to be to correct going forward. Number three, and I think this is a critical part of this, you need to employ everyone in leadership and everyone in the physician ranks to think about what are the possible solutions. I think a critical aspect of this is this takes you from a victim mentality, like, we can't do anything, poor us, this has been a horrible occurrence, it's beyond our control. You take someone from there to a victor mentality, because it also does shift the mind from a self-absorbed standpoint to one where you're actively changing into a problem-solving standpoint. So that's critical. And then I think the final question is, how can we help? How can I help you? How can you help me? How can we work together to solve these problems? Those are four critical questions. So from a physician standpoint, in addition to being trying to control for your unknowns and plan for random effects and course correct, from a personal standpoint for physicians, I'd love it if you would take a look at your personal parameters, things that I call your burnout box, and define these and then see what you can do to change them, to correct them going forward. And again, I like to call this the burnout box. There's a very simple way for me to conceptualize this and convey it to other people. The floor of your box is all your previous experiences, both medical and personal. The walls of your box are your work environment, your social, your spiritual, your mental, your physical and financial. And then the ceiling of the box is any sort of maybe limiting beliefs you have had about what's possible for you. And the issue with burnout is burnout and mental health, which I think are linked, are both woven into all the surfaces of that box. Perhaps your salary does not fit with your expenditures, and that has put you into a burnout situation where you're working harder and harder to try to keep up with expenses, and maybe that needs to be looked at. Perhaps there are work environment issues with your electronic medical record, where maybe in the short or the long term, scribes need to be hired to make that more efficient for the healthcare provider. There may be a need for more education on the EMR. There may be a need to scrap and find a new EMR. So I think if you look at what is driving your burnout in each level or each wall of your burnout box, and then you start to work on each one of those, that will continue to improve. I think a huge one for me personally and for a lot of our clients is the physical wall, getting good sleep, getting good nutrition, getting appropriate amounts of exercise, even in this time of unprecedented demand for your services. If physicians don't care for themselves, they will not be able to care for others, and leaders should realize that as well. So you may ask, what did this look like? What steps did we take? We have about a 50 employee practice with 12 partners. We're in the 8-figure range as far as revenue. And the first thing we did was we had a all partner meeting on Sunday, September 15th for about 3 hours. And we decided that our top priority was continuing to maintain good patient care. Then the question became, how were we going to do that? We maximized and retooled our resources and were able to start telehealth the following morning. And we continued to improve that over time. We had an all hands meeting with all employees the next morning, and we told them that obviously these are unprecedented times and these are very uncertain times, but we are going to guarantee them 3 months of pay, as well as 3 months of mental health benefits, either within our practice or from a external standpoint if they needed outside help. We physicians, the owners of the practice, took no salary for 3 months in order to make sure we had sufficient cash flow and sufficient cushion for any other shocks or issues going forward. And we sent home 75% of our employees. And then we rotated those employees as possible, depending on their health and other issues, back into the office. And we're able to outsource many of the in-office functions at their home locations. We triaged patients and saw urgent and emergent patients in the office, and all other patients were triaged to telehealth visits. And patients were actually very accepting of those. We never closed our office, and from a physician standpoint, essentially all vacations were canceled, and we wanted to make sure we had capacity and the ability to support each other going forward. This is how we controlled for our knowns, planned on randomness, and course corrected as things continue to change and improve. And you may say, well, Dr. Moody, that sounds great. You know, that you had a small organization, you were all on the same page. We have a 10 hospital, multi-thousand employee, base that we're trying to deal with. We employ hundreds of physicians. I get that. This may not work. That format may not work for everyone. But what I would recommend, if you can't recreate your world right now, is find your number one worst problem. Define that. Define a solution, and then put a deadline on that. And that actually about triples your results as far as getting that solution accomplished. Once you have accomplished that, then move on to the next one. Then move on to the next one. So prioritize and just start working down that list of needs. So ultimately, what we are looking for from a physician standpoint is we want the physicians to look at their box, define what is the most problematic, and start to work on those. So they start building and constructing themselves a new box that is now not burning them out, but is a structure that supports them and their life well. From a leadership standpoint, we want to be able to step through the controlling your knowns process and get to the point where then you can actually work your plan. Both of these steps, I think, are critical in that they help you avoid the downward spiral, because there tend to be bad things happen on top of bad things, happen on top of bad things, to the point where then you are no longer able to deal effectively with any of them. So if we can help physicians recover from burnout, especially in this time of pandemic, and help you manage your organizations and control the structures going forward, then you will stop that downward spiral and it will turn into an upward spiral, which will help you continue to improve and deal with this in the most effective manner. So again, this from a personal standpoint, you may go from being scared and directionless and spiraling downward to, for physicians, being empowered, being hopeful, being renewed, and knowing that you're valued by yourself and by your organizations. For those leaders of the organizations, you'll become confident, knowledgeable, prepared, and in control. Gandhi says, be the change you wish to see in the world. What I'm asking you is to be that change and tell that new story for yourself. So today, I've asked you to do a number of things and realize that obviously things have really deteriorated from the pre-pandemic to the post-pandemic time as far as burnout and mental health, but it does not mean we are powerless to make changes to help those. So again, I would love it if you would think about how you can control your knowns, plan for randomness, course correct, prioritize your people first, and imagine, believe, and create a new box for your own life from a physician's standpoint. I would ask you to ask those 4 questions. How are you? What is your problem? What is a solution? And how can we help each other to achieve that? And doing all these things, I hope that we can take burnout from a 30 or an 11 down to a 6 or an 8 or a 2 and move forward together in a productive manner. But really, at the end of the day, there's only one thing I really, really want you to do. I want you to tell yourself and the people you lead a great story and be the hero of that story. Thank you.